I just love that video. Every time I watch it, it gets me excited about this job all over again. And I've been doing this for 25 years. So that video is great because it highlights all of the different things that you can do, either right after school for some of those things, or some of them obviously with a little bit more training, right? You're not going to be a wildland firefighter straight out of EMT class, but you can move into the training for that, right? You're not going to be a flight nurse straight out of EMT class, but there's an opportunity for flight EMT in some regions, not here, but there's flight paramedic and there's flight nurse as well in this region. So a lot of super exciting opportunities. All right, I see one chat before I go to screen share. I'm gonna pop over there. Oh, great. Let's see my presentation. Always so clunky to go back and forth. I'm sorry about that, everybody. All right, so again, I'm with the North Seattle College EMT program. We are a 1/4 EMT class. So it's 12 credits, which is virtually a full load. 12 credits is the EMT class. And then we've got 1 credit for CPR, which happens 1 or 2 weeks before the quarter starts. And so it's a 13 credit certificate program. And this is something that's pretty exciting because though it's a lot of work, it's a full load, it's an intensive quarter. In just 1 quarter, you are eligible for certification and eligible to seek employment. So with just 1 college quarter, you can then go get a job and actually start working in the field, and lots of things that you can do after that. You can continue other vocational training, you can continue other academia, other college classes, and we'll cover that in a bit. Our program at North Seattle, like the other ones that I spoke of, is approved by Washington State Department of Health and the National Registry for Emergency Medical Technicians. That's the NREMT. And the National Registry is the certification test, that certifying body. At North, we offer the program every quarter. So it's summer, fall, winter, and spring. Our summer quarter, though, is quite competitive because we only offer 1 class instead of 2. Fall, winter, and spring, we offer 2 different classes, so 2 cohorts simultaneously, and that way we can just help serve more students. We found that we were turning away about 80 students every single quarter. And if you're turning away 80 people every quarter, it means that there's a need for more classes. So North started offering 2 classes every quarter. So we've got about 84 spaces. During COVID, we've limited that to 60 spaces just to allow for appropriate social distancing. But you can start this any quarter that you want to. Our entry requirements, you have to be at least 18 years old. You need to be at least a high school graduate or equivalent. You need a clean background check. So what we're looking at with clean background check is we don't care about driving infractions. We don't care about minor things, misdemeanors. But as EMTs, we serve vulnerable populations, and we want to make sure that all of the patients are safe. So you're not going to be able to get hired if you've got felony convictions, things like that. So definitely something to think of. You want to make sure that you're making some good decisions as you prepare for what you want to do with your life. So I've got a little bit of wiggle room with that at least 18 years old and high school graduate. I think I'm speaking to some high school students right now. So what does this really mean? If you are really close to 18 or you're really close to being a high school graduate, then you could still sign up for this program. If it's the spring quarter of your senior year, I would say absolutely you could sign up for this. But the State Department of Health will not give you an EMT certificate if you aren't at least 18 and a high school graduate or equivalent. So if you were to take this class, let's say your sophomore or junior year, it could be a problem for you because the state also requires that you are working and certified within 1 year of your training. Otherwise you have to retrain. So if you're really close to 18 and you're really close to high school graduation, no problem at all. But if you're not close, if you're more than a year away from those things, I'm concerned you might be wasting your time. So I'll show my email address a little bit later and you can email me questions about that. But these are kind of our entry requirements. I do have some wiggle room that I'm happy to speak with you later about. Where do EMTs work? I think that video highlighted it pretty nicely. EMTs work at fire departments. In our region, all firefighters are EMTs. You might find in some more rural areas, maybe smaller towns in the state or in places out of this state, that you have just firefighters and just EMS. But in our region, all firefighters are EMTs. There are some police departments that have EMTs, so they're police officers and EMTs as well. Search and Rescue has a lot of EMTs. Ski Patrol has EMTs working as well. Some work and get paid on Ski Patrol and some are volunteers as well. But if you are a skier, this might be something that's interesting to you because though maybe you're not getting paid because you're a volunteer ski patroller, you're getting a free ski pass. You're getting a lift pass for the whole season as well. So you get to ski and have fun for free. And if somebody gets hurt, then you go and help them. Ambulances, there are 4 regional ambulance companies. It's AMR, TriMed, Northwest Ambulance, and Falk Ambulance. And when I say region, I'm speaking of the King, Snohomish, Pierce County area. So outside of those areas, there are certainly other ambulance companies. I know there's Olympic Ambulance as you get closer to Bremerton, but kind of our region is that Tri-County, King, Pierce, and Snohomish County. There's 4 ambulance companies and they are always hiring. It's easy to get a job if you've successfully completed the EMT class. Emergency departments like to hire EMTs as their ER techs. We call them ED techs now, the emergency department, and clinics have EMTs working for them as well. At North, again, our EMT class is time intensive. We're a full load. We offer 2 separate classes. So our more traditional class, the cohort, is Tuesday evening, Thursday evening, and all day Saturday. Or you'll see our second, it's actually becoming quite a bit more popular. It's Monday and Friday, 11 a.m. to 7 p.m. and then Thursdays 6 to 10. And that's not a mistake. We actually do bring both classes together for the lecture. It's a great way to just get everyone together. All the students are getting good and consistent information. So what do you learn in EMT class? Well, honestly, the nitty-gritty, the basics is that you learn how to take care of a patient in an emergency, life-threatening situation. So there's medical emergency or there's a trauma emergency. And this class will prepare you to take care of patients having an emergency. We're really proud of our program at North. Our EMT instructors are very experienced. We've got over 50 years of combined experience with all of the lead instructors. And we have about 35 lab assistants, we call them. You would call them EMT instructors, but we call them lab assistants in our payroll. And all of those folks are EMTs and or firefighters, a couple police officers, 1 physician's assistant, and a few paramedics as well. And everybody is currently working in the field and they get to draw that from that field experience and come in and help you learn as well. It's great because they're helping you learn the skill of an EMT, but they also turn out to be really great mentors. Most of my students want to be firefighters or paramedics, but there is a good percentage. It used to be probably 80% wanted to be firefighters and 20% maybe wanted to go to medical school. And now it's probably 60-40. So about 60% of my students want to be firefighters or paramedics. And then the other about 40%, they want to do something in medicine. They want to go to med school, PA school, they want to go to nursing school, they want to be respiratory therapists. And I really think that the EMT class is one of the very best ways to start in any field for medicine. After just 1 quarter, you can immediately start working in the field and actually getting hands-on patient care experience. So if you want to be a nurse, starting with EMT, after 3 months, you can start working as an EMT while you're going to school. And I know that there are some nursing programs that are giving preference points to folks who have EMT experience, because those EMTs are getting patient care experience right away. In class, some of the things that we'll learn, we go through all of the basics for the National Registry and the State Department of Health for their skills testing. So in our class, you will do all of your licensing skills testing. And those skills tests, so we'll teach you how to do these things in class. We'll give you practice time, we'll give you feedback, and then we'll test you in class as well. That's going to be patient assessment for both medicine and trauma. It's going to be CPR and AED. You've probably learned that in high school. I know it's a state mandate now that high school students are learning cardiac arrest management. So CPR and then the AED, that automated external defibrillator. So we'll test you on that. We're going to give some tests for oxygen administration. So you'll learn how to give oxygen to a patient, medication administration. We'll do bleeding control and shock management, splinting. So there's long bone splinting, joint immobilization. So if somebody falls and breaks an arm or breaks a leg, you'll know how to take care of that. We do extrication and extraction. So pulling somebody out of a car. We pretend that somebody's been in a motor vehicle collision and they're stuck in a car, and we're going to safely take them out of that car. We'll work on spinal immobilization as well. So that backboard and then the KED, the Kendrick extrication device. So where do our students go to work? I mentioned it a little bit earlier. Most of my students want to be firefighters or paramedics. Some want to be police officers, and again, some want a career in medicine. So med school, nursing school, PA. Again, that's physician's assistant, emergency department technician, or paramedic as well. So many opportunities. And again, the class is fantastic because it's just 1 quarter. And even if you decide it's not what you want to do for work, just the life skills that you learn are phenomenal. There's some education pathways. You know, I think a lot of my students, they want the EMT certificate so that they are eligible to apply to med school, or they are eligible to apply for a firefighter job. And some fire departments require that you have your EMT before they let you apply for that. But working at the college, we really strongly believe in an academic pathway as well. So it's okay to sign up for the class and only be at our campus for 1 quarter, finish your EMT certificate, and then you can move on to something else. Or there's some really great educational pathways as well. So for civil service or public safety jobs at North Seattle College, we've got a brand new fire science associate's degree. For police officers, I know that there's a criminal justice associate's degree at Highline. And I know that we're really focused on medicine in this week's conference. North Seattle College has an Associate of Applied Science in Allied Health. So it's a 2-year degree. Your EMT class, that's 13 credits, would fit directly into the associate's degree at North Seattle. Again, it's the Associate of Applied Science in Allied Health. And then Seattle Central College moves on, and you can actually continue your educational pathway and get a Bachelor of Applied Science in either healthcare management or community and health education. So if you're college focused, there are some pathways for you as well. Or again, maybe you just want the EMT certificate and you want to go to work right away. Or maybe you want that EMT certificate and you want to apply to nursing school somewhere else. So in class, what's expected? I've mentioned that it's a lot of work. It's a pretty intensive class and we're a full load. We have 194 hours of class time plus 10 hours of hospital emergency room observation. A quick disclaimer though, right now because of COVID, we can't send any students into hospitals right now. We do have a contract with one of our regional fire departments who is allowing us to send students on ride along. So instead of our 10 hours at Harborview in the ER, we're sending our students to 8 hours with one of our fire departments, so riding on an engine or an aid car. I asked my students about how much time you're spending outside of class. Though I can't mandate your study time, I certainly, I can't watch you study when you're at home, but I'm 100% certain that if you are not working outside of class, you won't be successful. Really, it's just, we have so much to cover and you need that muscle memory, you need that repetition of practicing your skills and studying for the tests as well. My students this quarter told me it's about 5 to 10 hours per week of reading and practicing their skills outside of class. So you're in class 16 to 20 hours a week, but it's doable. It really is doable. Most of my students work full-time and are in class as well. you're going to sacrifice something, but that's okay because it's only 2.5 or 3 months and you can do anything for a short period of time. And again, most students work and are in class as well. Because we are bound by the State Department of Health, we're required to have a certain number of training hours. So it's not like what I would call an average college class where you can sign up, pass your tests, turn in a couple assignments and pass the class. Attendance is quite mandatory because we need a certain number of training hours. But we understand life's going to happen. You might have a car breakdown, you might have a family emergency, you might not feel well. So we do build in a little bit of wiggle room, but you can't miss more than 8 hours of class time. So I always get a lot of questions like, what, do you think I can do this? Is this something I want to take other classes as well? Is this something I can do? As I mentioned in the last slide, I think that you can do it. I would say if you're taking a full load of pre-med classes at University of Washington, probably not the time to sign up for EMT. You don't want a full load at another university and take EMT class, but you could take one class, if it was an easy one for you. You can work. It's, you can have a family, you can have your family time, and it's definitely doable. The cost is a little bit expensive, I'll admit, but I think we're the cheapest in the region. And I cringe a little bit because I know Stephanie's here from Tacoma. I don't know the exact cost of Tacoma's class, but I've researched the other ones. Everett's is a little bit more expensive than ours. AMR is one of the ambulance companies, and they put on 2 classes every year, and theirs is about $1,400 or $1,500. At North Seattle College, our EMT class is about $1,350. And then there's a CPR class on top of that. So it's a bit expensive. Does financial aid cover it? If you take the EMT class all by itself, financial aid does not cover it because it's a 1-quarter certificate program. But if you are in a degree seeking program, then financial aid could cover it. So if you're signed up for the fire science degree or signed up for the Associate in Allied Health, those classes fit in and you would be a full-time student. So in that instance, your financial aid would. But there are other scholarships as well. Workforce education, the Pride, I think it might be Pride Foundation, their scholarship would work for it. So there's Medical One Foundation has a scholarship as well. Some equipment and materials. Yep.
I was going to say there's a question in the chat. If you were to do a different health field path, can we take the EMT course in the same quarter? Would you like to respond?
I'm happy to respond to that. I'm not quite sure that I understand the question, though, if you can help a little bit. A different allied health pathway.
Hannah, if you want to unmute and ask your question, that'd be fine. Hannah? I am thinking that I get this question a lot for TCC as well. People are saying, oh, if I want to be a sonographer, can I take this too? And oftentimes it's pretty rigorous. So you're taking a full-time course load and adding in a completely different course load that has some clinical obligations can be a bit challenging. But like Megan was saying, it's really common that people use EMT kind of as a pathway to get started in a healthcare career path outside of emergency medicine, because it gives a really strong, amazing foundation of knowledge to help you as you pursue prerequisites for another program or get ready for those whatever other healthcare career. I'm not sure if that answered your question, Hannah. Does that sound about right, Megan?
That's exactly right. I would say if you wanted to take one other class, sure. I think it would be very difficult to take a full load. So if you, as Sabrina was saying, if like sonographer, if you're doing something else, I would not suggest take EMT with another full load for your allied health program. One class would probably be okay. And I think most students start with us as EMT is kind of the first thing that they do, and then they start to build on other things. One of the great things about EMT, I know I mentioned it's 1 quarter, but after 1 quarter, you're eligible to become employed. And the EMT shift work, EMT is an entry-level job, so it does not pay very well. Think of it as your stepping stone, but the shifts are wonderful. So if you got on a 24-hour ambulance, then you work 2 days a week. And all the other time you get to spend in school, and you're working hard, right? You're going to be up all night, but you only work 2 days a week, which is 8 days a month. You've got tons of other time that you can spend with other school work, studying, things like that. So really, really great job. And I think that's why most people start with EMT.
And there's another question from Stuart. He lives closer to Pierce College. Would you recommend attending there rather than Seattle?
Well, I think Seattle's is great, but I've heard really phenomenal things about Tacoma. And I know of the coordinator there, Melissa, and she is wonderful. So I think that if you live close to Tacoma, you should sign up for that one. They're both really, really great programs. For North, we allow for admittance based on an entrance test score. So it's kind of an advanced first aid. So everybody gets an equal shot at North Seattle. You just have to have studied for the pretest. It's my understanding at Tacoma, it's just kind of open enrollment and kind of first come, first serve. And so folks that are already students at Tacoma are gonna probably beat you into that waiting list. Maybe Stephanie can help with that a little bit more. But
I can speak to that. It is a first come, first serve enrollment at TCC, but we're always looking at ways that we can change that. So just kind of checking in. But I always tell people I work with all the health sciences at TCC, and people ask me, oh, should I apply here for nursing or somewhere else? And it's like, apply at multiple programs, right? And you might get in one or the other. And there's lots of places that have this very, very similar training that is very good. And we don't want you just waiting for one particular spot, putting your life on hold forever. So if you don't mind the traffic and you're thinking you really want to do this, I would say apply to multiple programs.
That's great advice. Yeah, you know what? I don't like to spend a lot of time in traffic, so I would say, yeah, try to find a program close to home. Don't forget, Pierce is down in your area as well, so that's an option. And I will, so another plug for North, light rail will go all the way to Northgate, and there's a pedestrian bridge right across the freeway starting this fall. So there's going to be better commuting options as well. I'm going to stop my screen share now, just so that I can kind of help with some of these questions. Looks like we got a couple minutes left.
Any questions from the group if you want to unmute? I have a question for Megan. So what's your favorite part about the program?
So favorite part of, just honestly, I feel like this is such a cheesy answer, but just the people I get to meet. Every quarter, I get 60 to 80 new students, and I've just met some amazing people. Our instructors are great. So I honestly get paid to hang out with my friends. And so I love teaching there. I love that program. It just draws in wonderful people. And I learned so much from the students as well. And it's one of the reasons I chose adult learning as my profession. And I couldn't decide if I wanted a career in medicine or career in education. About 10 years ago at this crossroads in life, and I thought education is really where I should be. I love it, but I get to do both. And so I think that's really wonderful. But getting a chance to just meet people, learn from them, and help people reach their career and academic goals is really my favorite part. And I never get bored. Every day is something different, and every quarter is a whole new group of students.
That's great. Stuart's asking, are summer quarters the same for other programs?
Stuart, maybe unmute and help me with this a little bit. If you mean other programs like other colleges, I'm not sure about that. I actually don't think that the other colleges have a summer EMT class. Not 100% certain on that. I know Everett does not.
I thought we did. I'm not sure.
Okay.
I think PCC might. Best bet though. Okay. Always look at the web pages, and they'll tell you, when they offer it for sure. Or reach out. If you have a question, there's usually a way to reach out directly by email, and we welcome that. Don't be shy about asking those questions. I can say it's been fun listening to your presentation, Megan.
Thanks. So thank you so much for being here to help. It's always nice to see, you can at least make eye contact with somebody.
Sure.
So